Hello dear patients. Today we are going to review the case of fibroma on skin of base of penis. A man came to see us. Several months ago a dense neoplasm appeared in the area of base of penis. It bothered him during sex. It gradually increased. You can see it on the picture. Initially, during observation, I thought that this is atheroma. I'll remind you that atheroma is a sebaceous gland inside which sebum was collected. In some cases it gets purulent. This is the most common neoplasm on the body of penis. However, in the process of removal, I noted that inside this neoplasm there is no sebum and no sebaceous gland. It is quite dense. Here an anesthesia was done, anesthesia using injection method. So an injection was done and removal was done by radiowave method. Specimen, that is a piece of skin, was sent for histologic study with conclusion of fibroma. On the last picture you can see how such fibroma gradually heals in several days already. It's very important that the scar after such removal is not so big. If we see that picture, if the scar is bigger than the size of fibroma itself, with which the patient came, then it's removed by liquid nitrogen. During such size, I wouldn't apply sutures, as the size is sufficient for self-made tension of skin. Usually the scar that is formed is quite superficial. As I said before, if it's quite big, then it's advisable to do burning by liquid nitrogen, as is shown in several videos of clinical cases that you can watch on our channel. However, in this case, there was no such rough scar. A superficial scar that was hardly visible was there, so we did not need such burning. So even an experienced doctor cannot determine a neoplasm by sight, by taste. Considering that it is located under the skin, then the dermatoscopy does not provide a sufficient basis for diagnostics of such neoplasm. Opening and removal for histology gives an answer to the question about what exactly it was. As I said before, I thought that this was atheroma, but it turned out to be a different, slightly dense neoplasm that is sometimes related to ingrown hair, etc. But basically this is a growth of scar tissue inside the skin, subcutaneous fat that does not disappear on its own. Generally speaking, the other option was to remove it by liquid nitrogen initially. However, we achieved quite good cosmetic results during removal by radiowave method. If it is necessary to diagnose, treat and remove different neoplasms in the area of penis, you can consult venerologists and urologists of our paid medical center of Dermatov-Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics, treatment and removal of such neoplasms. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram.